Hare Krishna to all the devotees. A very warm welcome to all the participants who have joined to yet another exciting topic on Health Live Show that is on Hare Krishna YouTube channel. I am Yograj, representing Bhaktivedanta Hospital and Research Institute, which is a 300-bedded multi-speciality tertiary care NABH accredited hospital, which is located in Mira Road, Mumbai. We offer holistic healthcare services for body, mind, and soul with the advantages of allopathic, Ayurvedic, homeopathy, and alternative medical therapies under one roof. We integrate modern medical knowledge with holistic approach to promote overall well-being. Our experts emphasize the importance as a cornerstone of preventive healthcare. This initiative is a part of our flagship program, ISKCON Devotee Healthcare Services, which was launched in Mayapur in the year 2023. Through this service, we have supported the health and the well being of over 10,000 devotees nationally and internationally as well. Today, we will be discussing on keeping our heart healthy on this podcast to address the basics and more in depth aspects to the topic in a way that will be engaging and informative. Let me welcome our esteemed guest and today's speaker, Dr. Sandeep Patil, who is head of the department cardiology and who is an interventional cardiologist gaining 15 plus years of experience in cardiology department and is associated with Bhaktivedanta Hospital. Requesting participants to check on the bottom of your screen, we have mentioned 24 by 7 dedicated contact number where you can reach out to us for your healthcare needs. Also, the contact information is mentioned to organize such events for your congregation. Requesting participants also to drop down your queries in the comment section. We will get back to you with the answers very soon. So let's now talk on the today's topic, that is keeping our heart healthy. Hello, sir.
Hi.
So, starting with the question, can you tell us a bit about your background and what inspired you to become a cardiologist?
First of all, I would like to thank Bhaktivedanta Hospital for giving me an opportunity to have a one-to-one session with all the devotees regarding their cardiac status as well as whatever they have in their mind regarding their health of the heart.
Yes.
So, as you asked me regarding my background, so I'm coming from a very small place in Maharashtra, and my father was a teacher. My mother was a housewife, but very intelligent and very caring. And then after that, I got into 10th, married there, first candidate from that area,
Mm-hmm.
gone to Latur.
Okay.
There I got again a merit rank. And then after the MBBS, I did my MD medicine from Government Medical College, Nagpur.
Okay.
And there I got an uh, competitive exam for the DM,
Mm-hmm.
and then I got a rank and got admitted to Nair Hospital for DM cardiology, and I
Great.
passed out from there.
Mm-hmm.
Stayed for quite a few time, 9 years there after the DM.
Right.
Served the people from various areas in the India, I will say, most
Correct.
of from Maharashtra.
Okay.
And then afterwards, I joined Bhaktivedanta Hospital since last more than 8 years.
Wow, that's great. So, talking to the next question is, what are the most common heart health issues that you see in your routine practice?
So basically, nowadays, what I will say post COVID, we always discuss there are only two issues what they are leading the comorbidities in the patients.
Mm-hmm.
Means they are troubled by only two big systems. That is, one is cardiovascular system where
Correct.
we get heart attacks, we get strokes, and second one is cancer. These are two leaders after the COVID.
Yes.
So if you see the cardiac problems, what we come across in day-to-day practice, most common one is the coronary artery disease. That means somewhere you get blockages inside your arteries which supply your
Arteries.
heart.
Yes.
So they are the plaques of cholesterol. They get deposited in your arteries which supply the heart, and
Mm-hmm.
once they reach the level more than 70%, then they will try
Correct.
to obstruct your blood flow even at rest and exercise, and then
Mm-hmm.
the patient come with the symptoms.
Correct.
And then after the coronary artery disease, what we see is cardiomyopathies, where the muscles of the heart either they become weak or
Mm-hmm.
they become stiff.
Correct.
Then we get problems regarding the valvular heart disease.
Mm-hmm.
In India, particularly, we have a rheumatic heart disease where we get an infection at the age of 5 to 15 years. But
Correct.
unfortunately, for few patients, the immunity turns out in their own against their own body,
Right.
and they get damage in the valves. And that after a period of 10 to 15 years, then the
Mm-hmm.
symptom starts. The wall become narrow, patient become breathless.
Right.
So this is how the valvular heart disease, or then comes the congenital heart disease, as our predominant practice is adults.
Mm-hmm.
So we still get some congenital heart disease at that age also, like
Correct.
the defects, holes in the walls of the heart
Mm-hmm.
between the two chambers, that is
Correct.
atrial septal defect, PDA, ventricular septal defects.
Mm-hmm.
So these are, and the rhythm problems that we come across. A few patients have a very fast and irregular heart rate that
Mm-hmm.
produces trouble like breathlessness,
Correct.
palpitations.
Right.
Few patients have a very slow heart rate,
Mm-hmm.
so that we called as a conduction defects, or conduction system blockages. That is
Correct.
called as complete heart block.
Mm-hmm.
So that produces again syncope, that is patient suddenly gets giddiness,
Mm-hmm.
and there is a fall, and they come with to the ER department with a heart rate of 38 and
Right.
40. So then it becomes an emergency. So these are the
Okay.
common clinical scenarios we come across day to day in our
In your daily
daily
practices.
practice. Yeah.
Okay. So as you said, like after COVID, we have seen the current trend, which what we see has given rise to the recent heart disease cases. So would you like to throw some light over it?
Yeah, definitely. See, COVID has taught a lot of things to us,
Yes.
because during that time there was a fear that whether the universe will survive or not.
Correct. Correct.
Then somehow, with the advancement of science and with God's grace,
Mm-hmm.
the humanity came out of that pandemic. And afterwards, people started to recognize many more problems. Heart is one of those affected
Yes.
organs.
Correct.
So what we have seen after the COVID is two things. One group is more aware regarding their health. The other group is uh, again came back to the pre-COVID era.
Correct.
So, what problems after COVID? A lot of people had a misconception that COVID had increased the number of heart attacks,
Right.
or it is directly responsible for heart attacks. But
Correct.
that's not the scenario. See, heart attack is a culmination of many things. It's not a direct impact of some disease, because
Mm-hmm.
there are so many factors behind coming up to the heart attack.
Right.
So, what COVID has done is there is lot of issues with the patients. Stress has increased, either financial or family domestic
Mm-hmm.
stress. Then the lack of exercise, the lack of good habits,
Correct.
then incidence of diabetes and blood pressure that increased.
Right.
So all this culminated into coronary artery disease, that is blockages. And then ultimately what we are seeing definitely in last 10 to 15 years, not just COVID, pre-COVID also it started, because we call it as we are in a transition zone from
Correct.
developing to developed
Developed
countries.
countries.
And even our all the traditions are in transition, because we are the one
Yes.
who have witnessed all those transitions. So
Mm-hmm.
there was a nutritional transition, there was a industrialization, people coming from rural areas to the urban areas, and that created so many issues,
Right.
because and ultimately heart has to bear all those stress.
Correct.
So, and that's what we are seeing in clinical practice. The young
Correct.
patients, which 10, 15 years prior, we hardly seen any patient
Mm-hmm.
with heart attack coming at the age of 20, 25.
Right.
And now we are commonly seeing those patients. There is a data in
Mm-hmm.
published in various Indian journals, Indian heart journals, that
Right.
if you see now in 2023, 2024,
Mm-hmm.
50 out of 100 heart attacks, the age is less than 50 years. That means 50% of patients of heart attack, the age is
Absolutely.
less than 50 years. Out of
Correct.
that, almost 25 to 30% are less than 40 years. So this is what transition we have seen. Younger
Mm-hmm.
patients are getting involved.
Right.
So there are so many reasons for that. Why? Because we are Asian, South Asian people. So
Yes.
genetically also we are more prone for coronary artery disease at a younger
Absolutely.
age,
Right.
1 decade earlier than Europeans.
Mm-hmm.
Then the amount of disease, what we are surprised around nowadays is when we do angiography of these patients,
Hmm.
the amount of blockages, they are in severe form, that means whole
Right.
artery is involved, there are multiple blockages that we
Correct.
hardly see in younger patients.
Yes.
We calculate the biological age of the coronary arteries. If the
Mm-hmm.
patient has 30 years, gets calcification, gets multiple plaques, so his coronary age will be somewhere around 70.
Correct.
So this is the problem. The disease burden is more. The mortality, that means death from the heart attack, is more in Asian people, in younger people.
Right.
So that is how it differs from the Western countries. Though the disease came earlier and more severe in Western countries, now they have come up with various government programs and then cut down on all those bad habits, and now they are
Yes.
in better in terms of quality of life after these heart attacks.
Correct. Right. True. Now, talking about the risk factors and the early detection. So, what are the key risk factors for heart disease, and how can people access at their own risk?
See, whenever we calculate the risk, we always see whether these risk factor are modifiable or non-modifiable.
Non.
So non-modifiable, they are there. We cannot do anything for that.
Yes.
Like if your age for male more than 45 years, female more
Mm-hmm.
than 55 years,
Correct.
then male little more affected than female. Still, females menopause. After
Mm-hmm.
that, both are equal.
Correct.
Then your if you have a family history of heart disease,
Mm.
then that becomes a risk factor which is non-modifiable. So many people ask, what is the family history? Do we come to know regarding our family history? So first degree relative, anybody whose father had a heart attack before 55 years,
Okay.
or mother had a coronary artery disease before 65 years, that
Mm-hmm.
is considered as a family history. So I
Okay.
want to clear here, after the age of 55 years in male and 65 years in female, this is not a family history. This is
Correct.
related to the age. So don't consider that my father had a heart attack at the age of 75, so I am at risk because of the family history. It's not
Correct.
like that.
Okay.
It should be a premature coronary artery disease.
Right.
So that is one thing. Then, if you see increasing age is a risk factor, as we discuss,
Mm-hmm.
and then our South Asian uh, whatever genes we have, that is non-modifiable.
Correct.
Then modifiable risk factors, definitely we can work on that. There are many modifiable risk factors.
Mm-hmm.
Most important is your bad habits like smoking, tobacco use, alcohol use. They are considered as a modifiable risk factor.
Correct.
Then your diet habits, very important nowadays.
Mm-hmm.
We'll come to the details
Yes. Yes.
afterwards.
Yes. Yes.
Then lack of physical activity. Nowadays, people there are many papers which say that if there is a lack of physical activity, the risk is equal to like a smoker.
Correct.
So even if you are not smoking, but only because you are not exercising, then the risk becomes like a smoker.
Correct.
Then obesity, weight, excess of weight, BMI more than 30 is obesity. So that is again a risk factor.
Mm-hmm.
Then diabetes is important risk factor.
Correct.
There was a Finnish study which says that if you have a diabetes, it is equivalent to the heart disease. Means
Right.
at one point of time in your life, you will get a blockages in your
Absolutely.
coronaries. So this is
Yes.
how it is important.
Mm-hmm.
Then the blood pressure, this is
Correct.
another risk factor.
Right.
And important risk factors that we ignore in our day-to-day life is lack of sleep. Nobody
Correct.
bothers. Lack of sleep is an important risk factor.
Right.
Then if you see the other factors like uh, air pollution is now coming as an important risk factor for
Correct. True.
and stress, that there is no calculation of stress in our community.
Correct.
Stress is at two levels. One is domestic stress, another is an work stress, professional stress. So both
Absolutely.
these factors needs to be considered.
Mm-hmm.
So these are some factors where we can say they are directly responsible for heart diseases.
Correct. Right. So, is there any specific age would you recommend to start getting regular heart health checkups?
Yeah, see, there are guidelines. Definitely, why the concept of health checkup came in cardiology is because if you see diabetes, if you see blood pressure, they don't have any symptoms.
Correct.
That's the problem.
Right.
People think that I will go only when I will have a symptom of blood pressure. But
Yes.
unfortunately, they don't have symptoms unless they damage some other organ.
Correct.
So that is how there are world bodies which they recommend after the age of 20 years, at least once in 2 years, you
Mm.
should check your weight.
Correct.
At least those who don't have anything,
Mm-hmm.
at least once in 4 years, you check your sugars. Once in 4 to 6 years, you get your total cardiac checkup done.
Right. Right.
So this is how, but it differs from person to person. If
Correct.
suppose I am a person where my father has an premature heart disease,
Mm-hmm.
then I may need to go health checkup little frequently. I
Correct.
will say even if I don't have anything, I should
Yes.
go every 2 years.
Mm-hmm.
And because I have a first degree relative which has coronary artery disease, so I am more prone for heart attacks.
Correct. Right.
So no need to worry,
Mm-hmm.
but there is no harm in doing a routine test
Correct. True.
like your ECG, like your blood pressure, like your sugars, cholesterols,
Right.
because these are the pillars of the heart attack building.
Correct. Right.
So if we make them strong, then definitely one day you will get heart attack.
Correct.
So
Right.
that is how we try to find out all those factors
Right.
and work on them,
Mm-hmm.
control them. Then definitely your heart attack risk will go down.
Correct. Right. True.
So
So, other question is, what are some of the early warning signs of heart disease that people often overlook?
yeah, if you see the signs of heart attack, so nothing comes directly. That I will say.
Okay.
Only thing is awareness is not there amongst the society. So we have to create awareness regarding cardiac symptoms.
Mm-hmm.
Most of the times people think that no, this is not an heart attack. This is
Right.
just an acidity what we
Correct.
have.
A chest burn.
Chest burns, because if you see the food pipe and the heart, they are very close
Yes.
to each other.
Absolutely.
And if the food pipe burns, there is nothing very fatal. But if
Correct.
the heart burns because of the heart attack,
Right.
you will lose your life.
Mm-hmm.
So always don't judge yourself. So what are symptoms is some people may have a stable symptoms, like if they walk around, if they try to climb the stairs, then they will get a compressing pain on the left side of the chest,
Correct.
and this pain might go to the
That radiates to left hand.
left hand, right, and then some may radiate to the jaw also.
Correct.
And then after he stops the exercise, the pain will go. This is
Correct.
how this is called as a stable angina.
Right.
But there are patients who present with unstable angina or
Mm-hmm.
acute coronary syndrome where the pain starts at rest.
Got it.
They got severe pain on the
Right.
left side, compressing with sweating.
Yes.
Even if he walks for a or she walks for a small distance, they will
Correct.
get breathlessness.
Got it.
So they will look pale. So these are all signs where something is wrong, because patient looks sick during that heart attack episode,
Correct.
and vomiting will be there. Body will be
Mm-hmm.
under stress, so
Right.
it reacts like that only. So these are breathlessness, chest pain, breathlessness.
Hmm.
Some people might have breathlessness increase on lying down because of the low pumping in the heart attack.
Right.
So these are all worse signs. So we should identify those signs.
Mm-hmm.
So what I will say is your acidity burn will never go to the left side.
Correct.
It will never increase with the walking,
Right.
exercise,
Mm-hmm.
and so we should not get confused with that. Whatever
Correct.
confusion, we should get it sorted out. Uh, Wherever facilities available, you can go to a local good physician, get
Mm-hmm.
your BP checked,
Absolutely.
take his advice, get one
Right.
ECG done.
Right.
So at least that will make us safe.
Correct. Right. So, for this podcast, we have received one question. Uh, so the question is: I have 30 to 40% of blockage in my left descending coronary artery. I had a breathlessness problem and have constant fatigue. I also have an upset stomach. So, would you like to address this question?
Yeah, first of all, if we have a blockage which is less than 70% of luminal narrowing,
Correct.
so it will not trouble you. That is
Okay.
most important, because if you do these tests, many people will get, we call it as a non-occlusive coronary artery disease. That means
Okay.
it will not restrict your blood flow to the heart, even with exercise, where the
Mhm.
demand is more. So definitely these symptoms are not because of the 40% blockage. That
Okay.
one point I want to clear.
Mm-hmm.
Whatever breathlessness or upset stomach, they have something different as a reason.
Mm-hmm.
Breathlessness is a very gross terminology. You
Got
can
it.
get because of the heart disease also,
Right.
or lungs problems also, or even if your hemoglobin is low, you will get a breathless.
Correct.
So you have to get a thorough checkup with your doctor.
Correct.
But what I can say is, don't keep in your mind that this blockage is responsible for the breathlessness as well as this upset stomach.
Got it. Fine. So, again, participants who have joined us, again, I'm repeating this initiative is a part of our flagship program, titled ISKCON Devotee Healthcare Services, which was launched in the year 2023 in Mayapur, ILS. Through this service, we have supported the health and well being of over 10,000 devotees. So, the respective information is being flashed on your screen, so you can get in touch with us for the 24 by 7 helpline number what we have. And also for your congregation, you can also see the contact numbers in the ticker wherein you can get back to us. So, next question is, sir, for the people with the family history of the cardiac disease or a heart disease, what extra precautions they need to take?
Yeah, as we discussed earlier also,
Yes,
uh, first of all, we should know what is the family history of heart disease that I have explained.
correct.
Then, if our first degree relative has got coronary artery disease, that is a heart problem or
Mm-hmm.
blockages,
Right,
then definitely we should be cautious but not worried. That
right.
is more important,
Yes,
because it is not necessary that you will get the disease,
correct.
but same time you should not ignore it also. What I said is, if you are healthy throughout, then probably I will advise that you get your cardiac health checkup done every 2 years.
Right, correct.
And what comes under that is, get your blood pressure checked, get your cholesterol checked,
Mm-hmm.
get your ECG done,
Correct.
have a consultation with your doctor.
Right.
And then if something is there which is detected early
Mm-hmm.
without any symptoms, then definitely we can treat it
Got
as
it.
per the guidelines.
Right.
So you will get a normal life. So no need to worry. That's the message from this thing. Even if you have a father, mother, both had
Correct.
heart attacks. So it's not like an autosomal dominant disease.
Right.
So if you take precautions, probably it will not come.
Correct. Right. So, how can someone with high blood pressure or cholesterol they can manage their conditions better just to manage the heart disease?
Yeah, as I said, hypertension, that is blood pressure,
Mm-hmm.
as well as cholesterol, they don't have symptoms.
Got it.
But if same time, if we have to look into ourselves,
Mm-hmm.
whether my daily habits or my lifestyle is culminating into these heart problems.
Right.
Whether I'm a sedentary
Hmm.
person, whether I
Correct.
have more stress,
Right.
whether somebody is there in my family who has a
Hmm.
heart disease,
Right.
then at that time what we can do is, we should know the values of this uh, blood pressure, as well as sugars, as well
Right.
as the cholesterol.
Correct.
The numbers you should know. Even a layperson should know what is the normal blood pressure.
Correct.
See, if you see, ask me a normal blood pressure, it is 130 systolic, the upper blood pressure,
Correct.
and 80, the lower one, diastolic blood pressure.
Right.
So everybody should know that 130, 80 is our normal level.
Correct.
So
Right.
plus or minus 510 is acceptable.
Mm-hmm.
Then, if you ask me sugars, there is one test which is more accurate, which calculates the 3 months average, that is HbA1c.
Okay.
So everybody should know that if my HbA1c is less than 5.8, there
Mm-hmm.
is no question of any diabetes.
Got it. Got it.
If my HbA1c is between 5.8 to 6.4,
Mm-hmm.
then I am a pre-diabetic.
Got it.
So the condition before diabetes.
Right.
Then if my HbA1c, that is 3 months average blood sugar, is more than 6.4,
Mm-hmm.
then I have crossed the border.
Got it.
Now I
Got
am
it.
came into a diabetic world.
Right.
So all the precautions, whatever diabetic patient takes,
Right.
right from the diet, exercise, and doctor's advice, whether
Got it.
you need a medicine or not,
Right.
that should be done with the advice only.
Correct.
Because my caution is, they don't have symptoms,
Mm-hmm.
and don't let them to bring the symptoms by damaging the other
Correct.
systems.
Right. Right.
As well as cholesterol, what I will say is, there are four main values of cholesterol.
Mm-hmm.
One is a total cholesterol.
Right.
It should be less than 200.
Right.
One is LDL cholesterol, what we call it as a bad cholesterol.
Mm-hmm.
It should be somewhere less than 130.
Right.
100, less than 100 is a good value.
Mm-hmm.
Then if you see a HDL, there is good cholesterol also. So these are all lipoproteins which are attached to the cholesterol.
Correct. Right.
So the high density, that is HDL, is a good cholesterol.
Right.
It should be more than at least 40 in your blood.
Mm-hmm.
If it is more than 50, it is very good condition for you.
Got it.
And then triglyceride, not
Mm.
to forget.
Mm-hmm.
The triglyceride level should be less than 200.
Okay.
If it is less than 150, it is, we are happy to
Got it.
accept it.
Right.
So these are all, as I said, they are the fuel for the heart disease.
Right.
So if you restrict them here only,
Mm-hmm.
so you'll get a good results.
Correct.
Means
Right.
in long run, probably heart disease will not touch you.
Correct. Correct. Right. So regarding this question, only one of the participant they have asked, like she has recently been detected with blood pressure. So what are the daily precautions they
Yeah,
need to take?
definitely. One thing is, if you see the data, it's not an uncommon problem
Hmm.
that the patient should understand, because sometimes they get depressed. Why I got
Right.
a blood pressure at a younger
Correct.
age?
Correct.
And this leads to problems.
Yeah.
If you don't accept the things, 50% you lost the battle. If you accept the thing, you have won 50%.
Correct.
First accept it.
Right.
Ki, I have a blood pressure, and there
Mhm.
are ways to tackle it.
Right.
See, what are common questions we get in the OPDs? Oh my God, then I have to take whole of my life these medications.
True.
It's not like that. See, if you improve your lifestyle,
Mhm.
these are called as lifestyle diseases,
Diseases.
because
Correct.
somewhere our track has gone from these lifestyles, and they catch us.
Correct. Right.
So as far as the blood pressure is considered, it's easy to treat.
Right.
Believe me, it's easy to treat from
Hmm.
doctor's point of view as well as from the patient's point of view.
Correct.
Nothing rocket science in that. If you do a daily exercise, if you have a good diet, if you consume less salt,
Mhm.
if you listen to the doctor, that is
Correct.
also an important aspect.
Right.
If required, take medications,
Mhm.
take a good sleep, have a
Right.
less stress, your blood pressure will be controlled.
Absolutely. Absolutely.
But if I will tell you interesting data in India, there are some studies, we don't have a robust data
Mhm.
in our country. First thing is, we listen more to the laypersons than the doctors. That's the problem.
Absolutely.
So in blood pressure and diabetes, what they have found is,
Mhm.
those who are diagnosed, only 50% they take proper medications.
Correct.
50% they don't take proper medication. This is the
Right.
data. And amongst them, only one fifth have controlled blood pressure and controlled sugars.
Got it.
So if you have such a poor kind of response in treatment also from the
Mhm.
patient side,
Right.
then definitely you're bound to get all this pandemic of heart diseases. Because if
Absolutely.
you have a blood pressure, if you have a diabetes in your body, and on one day they culminate into heart attacks.
Absolutely.
So first job is to accept, treat them. So
Correct.
for the blood pressure, we should know what is my normal value,
Mhm.
and I should be a disciplined person. I will not say ki you don't enjoy your life. You enjoy your life, but same time maintain some discipline,
Correct. Got it.
because that discipline will bring lots of fruits in your life.
Right.
Then you
Right.
will enjoy your whatever healthy life is a fruitful life.
Absolutely. Other question, the viewer asking about how to lower the cholesterol levels.
Yeah. So if you see, one good thing I will tell you,
Mhm.
whether it's your blood pressure, whether it's your cholesterol, whether it's your diabetes, or
Correct.
whether it's your weight,
Right.
the measures are same.
Correct.
First thing is exercise. What the guidelines recommend is aerobic exercises.
Right.
And even a poorest of poorest man can walk
Mhm.
in a good environment.
Correct.
So walking, brisk walking is better, at least 30 to 45 minutes in a day.
Got it.
That's not a big job.
Right.
For at least 5 days in a week, we expect that most of the days we should do it,
Mhm.
but at least 5 days in a week will keep your heart healthy.
Got it.
Then, if you see the diet and these stretching exercises, they are helping you, but
Mhm.
not on everyday basis. If you can do it twice in a week also, they are fine, because they will keep your muscles better.
Right.
People ask that, can I do only yoga and not the walking?
Mhm.
I will say aerobic exercises like cycling, swimming, and walking, these are key pillars to keep you away from blood pressure
Right.
or control your blood pressure, diabetes, or heart disease.
Right.
So do aerobic exercises, and they are complementary. Stretching exercises, yoga is also good.
Correct.
That is complementary.
Mhm.
So no need to do, I will say, spend money on so much of gym and everything, because they
Got
are
it.
muscle building exercises.
Correct.
So we want exercises where they will help your heart rate
Mhm.
They will settle down your heart rate, they will bring down your blood pressure.
Got it.
So that is one aspect.
Right.
You do exercise on daily basis. Timing, if you ask me, morning probably is the best period. If
Mhm.
you are not able to do in the wherever time you get.
Right. Right.
Okay, so steps are important.
Mhm.
Morning, why it is important? Because since our ancestor era, morning period is considered as uh, a better period, because you
Right.
get a good sunlight there,
Correct. Correct.
and your concentration is good. So that is one thing.
Right.
Then is diet. So diet, if you see, as I said, we are in a dietary transition.
Mhm.
A lot of things comes in that day-to-day diet. So if you see, we are heading towards a fast food world,
Right.
where they are easily available, cheap. But the background of that is, majority times, the material which is used for this is also the responsible factor, that is
Correct.
palm oil and
Right.
coconut oil.
Absolutely.
They are cheap. So that's what in diet factor we can come on that.
Yes.
So keep your diet better. For the hypertension patient, keep your salt intake less.
Correct.
I
Right.
will say less than 5 gram of salt per day per person. But if you see the studies,
Mhm.
Indians, a single as an individual Indians, they
Right.
consume more than 12 gram in a day.
Correct.
So we should reduce that. Then have a good sleep, at least more than 6 hours, better that 7 to 9 hours you
Got it.
sleep.
Right.
And then stress management, be
Correct.
happy,
Right. Right.
enjoy yourself in some music or something like that. So this is all simple things we can do to bring it down.
Got it. Got it. Fine. So, as you rightly said, in the today's corporate world, also, everyone has their personal tensions, then the work-related pressures, the target-related pressures they have. So, many of the youngsters, what they do, like they prefer evening time to do the workout. So, as you said, like early morning is the right time to do the pranayam, yoga, and the exercises. So, but what about those population who basically caters and do the exercises rigorously in the gym? Because we have also seen a lot of cases like getting cardiac arrest in the gym.
Yeah. That is one thing. A lot of social media, they hype for
Yes.
those gym related heart attacks.
Correct.
So I also got many patients, young patients,
Yes.
because problem is that you focus only on muscle building in that.
Correct.
And a lot of people, they use steroids in gym also.
Absolutely.
And that is not good for your health, because it will ultimately cause, in long run, you will lose, like your sugars will be deranged,
Absolutely.
and your muscle will become weak afterwards.
Correct. Correct.
So your blood pressure will shoot up, so that we don't want.
Mm-hmm.
What Even for a younger generation, even if you are doing a muscle building exercises,
Mm-hmm.
it should be started with aerobic exercises.
Correct.
And it should be moderate, mild to moderate for cardiac patients, I will say.
Right.
And it should not be very vigorous
Mm-hmm.
for even for younger patients. And timing, as you said, morning, evening, what I personally feel, that in cities, metro cities like Mumbai, people don't get time, they are in a hurry. So if you tell them only do it in morning, probably they will not do it. So
Absolutely.
that is what,
Yes.
even if evening there is no issues,
Mm-hmm.
you can walk around. Walking is important. At
Correct.
least 8,000, 10,000 steps you should have.
Right.
So preferably in the morning. If you don't get time, encourage yourself to get it in the evening.
Got
You will
it.
get a good sleep
Mm-hmm.
if you do a good exercise even in the evening.
Right.
But it should be a safe environment in the evening,
Got it.
and do it in a place where it is really calm and cool, and
Mm.
without any traffic hitch and all, because people
Right.
have lost life while walking by the side
Correct.
of the roads
Right.
also.
Right. True.
So that is a message to everybody. Ultimate aim is walking, walking, and walking.
Correct. Right. So on this only we have received one question like, what are the daily routines one should practice to avoid heart disease?
Yeah, that's a very important question. It will make you a complete man. So, which will be a happy and healthy heart.
Correct.
So, if you start your day early in the morning,
Mm-hmm.
probably you will get a 7 to 8 hours sleep.
Mm-hmm.
Then if you get up, then what happens in India is fruit consumption is not a routine practice in our
Right.
India,
Correct.
because if you go to the Western countries, probably they are the ones where fruits are there in their house,
Right.
juices, fresh juices are there in this house.
Correct.
So our fruits are in fridge.
Mm-hmm.
So we have to take extra effort to go there and take it out. So yesterday
Correct.
only I
Yes.
told my wife that. So at least you bring out that fruits from that fridge
Yes. Yeah.
and keep it on your tea table.
Uh-huh.
So at least if you see them frequently, at least one time you will have a
Correct.
desire to eat it.
Yes. Yes.
Okay, so
Yes.
that
Right.
is one thing.
Correct.
Then after your have a breakfast. Skipping breakfast is also a risk factor for cardiac
That's
diseases.
really
Remember,
important.
that's an important
Yes.
topic, because in a hurry, lots of time we don't get breakfast in
Correct.
because of our work pressure and
Right.
all.
Right.
So that's why you keep some reserve time for that.
Mm-hmm.
After that, you exercise either pre or post breakfast
Got it.
for 30-45 minutes.
Mm-hmm.
Then office work and everything, and you have a good heavy breakfast, and then you can have a good lunch. So post lunch naps is an also topic of discussion.
Yes.
So many people ask, I have a habit of having naps in the
Correct.
afternoon.
Right.
So what I will say is, if you go by literature,
Mm-hmm.
there the alarm is needed, not
Got
for
it.
the night sleeps.
Correct.
If somebody is need somebody needs an alarm at night sleep, but that's not a good sound sleep. You should go to the sleep by your spontaneously and get up spontaneously. That's a
Got
good
it.
sleep.
Correct.
In the afternoon, short naps, it will make you energetic.
Right.
If many people, they don't have a habit also
Right.
of sleeping in the afternoon, so that's not a compulsion, but those who have, they can have short naps.
Mm-hmm.
Then in the evening, again, you can have a light breakfast.
Got it.
And what I mean to say is, our circadian rhythm for the sleep, if you see the melatonin levels in
Mm.
our body,
Yes.
melatonin is an enzyme which is responsible for majority times our sleep.
Correct.
So that starts peaking after 8 p.m. and probably 10 p.m. or 11 p.m. it is peak.
Got it.
So if you see our ancestor time, if you go in villages, we are from villages only.
Right.
So after 8 o'clock, you hardly see anybody on the roads.
Right.
So dogs are barking and all.
Hmm.
So their circadian rhythm matches the natural things.
Correct.
So at 10 o'clock or 11 o'clock, your melatonin levels are peak.
Mm-hmm.
And then after 3 o'clock, they come down.
Correct. Right.
So you should utilize that natural curve.
Got
But
it.
what happens in metros is 10 o'clock, many people, they don't have their dinner also. Purpose of this discussion is, it's difficult, I know it's difficult for
Correct.
us also,
Right.
but can we change it?
Mm-hmm.
Because if you have a 3 to 4 hours empty stomach, means no food before sleep,
Mm-hmm.
it's a very good inducer of sleep.
Got it.
So that means you should have your, if you are going to sleep by 11 o'clock, what I
Correct.
consider in
Right.
Mumbai, then at least 8 o'clock, what I tell to my patients also, get your dinner finished by 8 o'clock.
Got it.
And it should be a light one. It should
Yes.
not be a stomach irritating like a spicy one
Mm-hmm.
or a oily one. Keep it light.
Yes. Yes.
So your dinner should be light,
Hmm.
your breakfast should be heavy.
Right.
So it's a tapering curve. But what we say is a reverse one in Mumbai. They don't take breakfast. There is hardly any fast, whatever small lunch. And once they come to the home, they are the king. Then you have a heavy dinner.
Yes. Yes.
So that's what is a trouble for your body.
Got it.
So go to the bed and make the bed environment like, don't keep any gadget in your
Mm-hmm.
bedrooms.
True.
Keep your lights off.
Yes.
Some days you will have trouble if even if inducing the sleep, but
Mm-hmm.
the body gets adapted to that.
Got it.
Okay, so you hardly need any help of the pills and all,
Right.
and get up early. So that's the best time. This is what an ideal scenario for a healthy heart. But
Right.
whatever factors you can patch it or correct it,
Mm.
they're not very difficult. I will say nothing very
Right.
impossible thing.
Yes.
So small changes you can make and keep
Right.
your heart healthy.
Correct. Correct. So, other question we have like in our devotee circle. So, basically, what about the fasting? Because in fasting they are not allowed to take even the breakfast, nirjal upvas, kind of. Yeah. So, would you like to throw some on light on that?
Yeah, see, there are two ways to think on that.
Hmm.
So one is fasting, intermittent fasting,
Yeah.
and fasting, which has a very long way, prolonged way too. So, what I will advise, even if you are doing fasting, so at least in between we should have some fruits,
Mm-hmm.
or which can give you at least needed sugar
Got it.
and energy.
Mm-hmm.
Because if you fast for a prolonged period, then definitely problem is your stomach levels, the acid level may go high,
Mm-hmm.
or whatever cycles you built up.
Right.
At least 8 hours we have a gap in your breakfast, whatever lunch
Hmm.
or dinner. So if you consider it is a 8 hourly, so I will say 12-hour fast is also is not a problem. But if you are going for a strict fast,
Mm-hmm.
then definitely intermittently you can have juices, or you
Hmm.
can have a whatever fruits, they are the
Right.
best ones.
Yes.
So that food is
Can be taken
can
care
be
of.
taken.
Fine. Let us talk about the modern treatments and innovations. So, what are some of the latest advancements in cardiology that you are excited about and you want to share these things with us?
Yeah, if you see the advances, definitely the world is advancing, and in cardiology, there are advances in various fields. Like I will say, advances in the medicines,
Right.
advances in the technologies,
Mm-hmm.
the procedure advances.
Correct.
So, if you see the medicines, I will give you an example of the heart failure patients,
Mm-hmm.
where the heart muscles are weak.
Right.
So initially we have had a very limited drugs. If you say 10 years prior, we had a diuretic, means which removes the fluid from the body,
Correct. Yes.
and some beta blockers.
Mm-hmm.
But nowadays there are pillars of the heart failure. That is, we have a lot of drugs like ARNI, we have a lot of drugs like HLT2 inhibitor. These are
Got it.
names of the drugs.
Yes.
So what they have done magic is they have improved the heart pumping.
Got it.
Initially, the drugs were not improving the heart pumping; they were giving just relief to the patient.
Mm-hmm.
And you'll be surprised, if your heart pumping is less than 40% or
Mm-hmm.
30%, 5%, there is a chance that 50% in next 5 years the patient will not survive.
Got
So
it.
this is that dangerous disease, and quality of life will not be good.
Mm-hmm.
So these medications, definitely there are innovations. Initially they were costly,
Right.
but nowadays they are off patent, many of the drugs available. So I make it sure that every patients of those innovations, they should get the advantage. So
Got it.
you should use those drugs. Don't count the drugs,
Mm-hmm.
because they are helping you.
Right.
Nothing more than if your muscle becomes normal. There are many patients where muscle becomes normal. They become,
Right.
if you are saving lots of money
Hmm.
in your working life, if you are
Right.
healthy,
Hmm.
then your earning will be more. There will not be no hospitalization. That
Right.
also adds on to your economical burden.
Right.
So that drugs innovation is there.
Correct.
So in, if you see in transcatheter advancement, means there are treatments of valves now without any stitch.
Mm-hmm.
We recently had an aortic wall replacement, that is called as TAVR. So in a Bhaktivedanta hospital,
Got it.
uh, with Dr. Harminder sir has done it. So basically, that is a procedure where we deploy the wall, means we put a wall there through a small hole.
Mm-hmm.
Initially, there was an open heart surgery for that wall,
Right.
and a lot of patients were not willing for that.
Mm-hmm.
So nowadays, those patients have an option, though it is little costly, but definitely I'm sure within the next 4 to 5 years, those costs will come down.
Got.
So that innovation is definitely helping human beings, because that
Mm-hmm.
will cut short your hospital stay, cut
Right.
short your morbidity.
Correct.
Nobody wants a big this sternum to be cut.
Mm-hmm.
So then there are mitral walls also, the leakages in the other walls on the left
Right.
side.
Yes.
Though there are mitra clips which reduces those uh, this thing leakages in the valves.
Right.
And in congenital heart disease, we have devices which closes the holes in the heart
Mm-hmm.
without any stitch.
Got.
So they are there since long time. Even a smallest of smallest baby can. We have
Mm-hmm.
recently done in Bhaktivedanta Hospital a 6 kg baby, where we have closed PDA, that is a connection from the heart to the pulmonary arteries, which
Right.
the arteries which go to the
Hmm.
lungs. So these are the innovation. Definitely, they have come to some cost because there are lots of funds utilized for the research. But
Right.
over a period of time, they will come down. So that is how innovations are there in the medicines also.
Hmm.
Innovation are there in the interventions also. So that we should take an advantage.
Got it. Got it. Uh, just a my question, sir. Sometimes I had came across to so many corporate clients of mine, where in one of the case, which recently they had came to Bhaktivedanta hospital, and their heartbeat was less. So doctor has prescribed
There are certain patients where changes happen in their conduction system, because see, our heart beats with an electrical impulse,
yes.
and that is generated from one of our chambers that is called
Hmm.
as right atrium, where
Correct.
SA node is there,
Right.
and that the electrical impulse, they travel through the conduction system.
Right.
So somewhere you have that the conduction system is defective,
Mm-hmm.
and that not all pulses they transmit to the other ventricle.
Got
So that is called as a complete heart block.
it. Mm-hmm.
So that complete heart block will lead to the signals from the atria will not go to the ventricle.
Correct.
So there will be a dissociation between atria and the ventricle because
Mm-hmm.
of those signals not reaching there.
Right.
So that is condition what your patient probably had.
Yes. Yes.
So see, what is our normal heart rate is between somewhere 60 to 100. So there is a range always. So if you go very low down to 38, 34, then your brain also doesn't get a good supply. All the
Correct.
organs will be
Right.
affected.
Yes.
So in such situation, patient may get sudden onset syncope. They fall down. Lots of fractures happen, injuries happen. So those patients, once they come, we try to find out what is the cause of that,
Mm-hmm.
whether it's a age-related issue.
Hmm.
Rarely in heart attacks we can get in inferior MI.
Got it.
So they are treated only by angioplasty, but those are because of the age-related issues. There definitely a small device that is called as a pacemaker, which is
Right.
smart device.
Right.
It's like an inverter. It's a simple thing. What an inverter does is once your the light goes, it automatically takes over.
Right.
So it's a smart device pacemaker. It automatically takes over the sense that the heart rate has gone down to certain level,
Mm-hmm.
whatever you have set,
Right.
and then it gives from its own.
Right.
So we put leads from that generator inside the heart chamber,
Mm-hmm.
and that will give electrical impulses. So
Got
this
it.
is how
Got it.
pacemaker works.
Hmm. Right. So the other question is, people have a lot of confusion between stress test and 2D echo. So which should we prefer?
See, if you see stress test and a 2D echo, both are investigations which are done to find out your heart's condition.
Right.
2D echo is, I will say, it's a simple term like a sonography of the heart.
Mm-hmm.
This is to see your heart muscles,
Right.
whether they are contracting and relaxing normally, because
Mm-hmm.
heart is an elastic organ. It has to contract and
Right.
relax in the same pace.
Got it.
Then your valves, which
Mm-hmm.
are there in between your chambers,
Right.
and then your septum, then your pumping of the heart. So this is how the 2D echo does.
Mm-hmm.
So that's an important investigation. It's a non-harmful because it's based on sound wave technology.
Correct. Right.
So the other investigation is a, treadmill test, what we will call it as a stress test,
Stress
electrical
test. Hmm.
ECG based test. So they will basically test your capacity.
Right.
So what is your capacity is how much you can walk around, and the supply of your heart,
Mm-hmm.
because gradually we increase the speed as well as the level in that platform where you run.
Right.
So it goes above the gravity.
Mm-hmm.
So that will test your heart's capacity,
Right.
and your supply in the form of whether you get a symptoms like in a low exercise you will get a chest pain
Mm-hmm.
or sweating, breathlessness, and ECG has a lot of changes from the baseline. That we call it as a positive treadmill test, where
Okay.
definitely you need to see whether your blood supply is normal or it is
Now it has reached to 6.6, and have a lot of stress from work. So how do I overcome? Because I feel fatigue and restlessness at times.
yeah. See, many of the times this is called as a pre-diabetic condition.
Mhm.
but gradually you are heading towards a diabetic condition.
Right.
Because in India, if you see, the conversion from pre-diabetic range to diabetic is very fast as compared to
Right.
the other
Correct.
countries. So at this moment, we can avoid medications. What
Mhm.
I will advise you is reduce the weight,
Mhm.
have a good exercise, and diet.
Correct.
So diet, if I elaborate,
Hmm.
so a lot of people ask what oil I should use. So I will say all oils except palm oil and coconut oil
Right.
should be avoided in your food.
Right. Correct.
See, there is data also. So why this? Because they have lots of saturated fat.
Correct.
We don't want saturated fat.
Right.
We polyunsaturated or monounsaturated fats are fine.
Mhm.
So I will tell you the problems in the countries where economy is little marginal.
Right.
So if you see in India, highest incidence of blockages and heart attacks is in Kerala.
Okay.
So one reason for that is use of coconut oil in Kerala.
Right.
So that is one of the reasons why the number of heart attacks are more if you see in India.
Mhm.
The other reason is metros. From the if you compare the rural to the metros, whatever street vendors or hotels, if you see, they use palm oil
Correct. Right.
because palm oil is little cheaper. Little means more cheaper,
Mhm.
and they repeatedly heat that oil.
Oil.
So what
Correct.
happens?
Right.
If you repeatedly heat that oil, it becomes hydrogenated.
Correct.
More fat will come out because of the finances, and it is cheap.
Correct.
So nobody will use a palm oil for your street food.
Correct. Right.
So if you burn it again and again,
Mhm.
it will release more of a fat.
Correct.
So what I will advise is rather than those, see what happens, and affordable food is not healthy. But if you see the rates of fruits in India, the apple is somewhere around 200 per kg.
Yes.
So that is how people use fruits only when they go to the hospital to meet somebody. So rather than eating
Yes.
before,
True.
so that's the problem.
Hmm.
And the another thing is social media. As you said, food bloggers and all,
Yes.
they hype much regarding all the outside food.
Mhm.
But my advice to everybody is rather we should focus on a healthy food.
Correct. Right.
Once in a while, everything is fine,
Right.
not for the day to day life.
Right. Right.
So you have good protein source. What problem is in India is we are vegetarian, good, but there is a term used as a contaminated vegetarians because our diet is more of a carbohydrate.
Right.
If you see chapati, if you see rice, if
Mhm.
you see potatoes, they have high glycemic index and carbohydrates.
Right.
Sweets, what happens? All these carbohydrates that gets converted into triglyceride cholesterol, which is
Mhm.
not good.
Correct.
So those patients already we are genetically vulnerable. Already we have a lack of exercise. So these gets converted into your cholesterol.
Mhm.
So our Indian cholesterol is something different from Western
Right.
because of our food habits.
Mhm.
Our triglyceride, if you see our data, day to day we see the cholesterol reports.
Right.
So our patients have a problem of low good cholesterol, that is HDL.
Right.
There is no drug which can substantially increase the HDL.
Got it.
Other is the high triglyceride,
Hmm.
means the carbohydrate which is responsible for that. So
Right.
what I advise to my patients is rather than going for rice in day to day your this thing, we can use millets. Even our government is encouraging millets like
Yes. Yes.
bajra, jawar, nachni. They have additional minerals also. So that should be there. And proteins are very less in Indian day to day life.
Absolutely.
So what gives us protein from the vegetarian diet is the
Mhm.
dals.
Correct.
If you see moong dal, that has the highest amount of proteins,
Right.
but we hardly use it.
Correct.
So dals are there, which gives nuts are there.
Hmm.
All the nuts have good proteins. Then if you see all seeds have good proteins.
Correct.
So sesamum, that is still you can keep it as a mouth freshener
Right.
in your
True.
room.
Right.
So that will give you a good uh, proteins also and the
Absolutely.
minerals also. The another
Right.
problem in our cooking is we overcook the food.
Correct. Right.
So that's the problem. If you overcook it, the nutritional value, the micronutrients, they get destroyed.
Destroyed. Yes.
So it should not be overcooked.
Right.
So the amount of rice, potatoes, amount of then another question a lot of people ask is ghee. Butter, ghee, these are in a limited quantity we should have.
Yes.
I always advise a cow ghee less than 1 teaspoon in a day, not more
Correct.
than that.
Right.
So that is, I have seen a lot of devotees coming to cardiology OPD which have a deranged cholesterol level. Probably one of the reasons is consumption of sweets, consumption of high carbohydrate in the form
Correct.
of rice,
Yes.
potatoes,
Yes.
and in prasadam we have sweets also, and then lack of sleep also.
Mm-hmm.
So many of that they get early in the morning,
Right.
and if you are late in the night to get into bed,
Correct.
then definitely you will have a less sleep.
Mm-hmm.
So lack of sleep is again an ignored problem in everybody. So because if you have a lack of sleep, there are lots of problems because your blood pressure will be high, your heart rate will be high, even if your weight will be high.
Correct.
So that because there are leptins and there are other secretions, they are high. If you have lack of sleep, that will increase your desire to eat,
Correct.
so
Right.
you will get more weight.
Right.
So that is how sound sleep uh, is a good solution for
It's
your heart.
for
It will
solution.
keep
Right.
your heart
Right.
healthy.
Correct. Right. Talking about sleep, one question. Snoring impacts heart health?
Definitely, it's a very good question. Snoring, we often make a fun of it, but it's not topic for that, because in long run, if you see,
Mm-hmm.
snoring is of two types. One is a snoring which doesn't disturbs your oxygen levels at the night.
Right.
That is called as apnea. The other people who have a long gap of respiration
Mm-hmm.
in between the snores.
Right.
So those are dangerous. So those who have overweight, uh, and if they snore, my advice to them is see whether you are alert throughout the day.
Mm-hmm.
If you are not alert throughout the day, if you feel drowsy and feel sleepy,
Mm.
then definitely you have not got a good sleep.
Correct.
Your oxygenation during the sleep has disturbed. So
Absolutely.
what I will advise them is get your sleep study done if possible,
Correct.
because the best solution for that is reduction in the weight.
Right.
If you reduce the weight, the snoring will come down.
Absolutely.
But if you don't have a proper oxygenation in the sleep,
Mm-hmm.
so your blood pressure will be high, your sugars will be high, your weight will be high.
Got it.
So that will again, there will be a vicious cycle,
Right.
and it will disturb your cardiac status.
Right. Correct. The other question we have: does angioplasty affects pregnancy chances? After angioplasty, can a lady conceive?
Yeah, definitely. See, angioplasty is to make your heart healthy. If your heart is healthy, then
Mm-hmm.
it can sustain.
Absolutely.
So that is how the main purpose of angioplasty is what? Removal of the blockages. If you
Mm-hmm.
remove the block, heart will get a good supply.
Right.
So it's not in contraindication. Only thing is it should be guided by a good physician or a cardiologist,
Okay.
and along with a gynecologist. So
Mm-hmm.
I will suggest that whosoever is planning for pregnancy,
Got it.
if that lady has an heart attack before, get one advice from the doctor, show them their medications, your
Mm-hmm.
current status, your
Right.
heart status, 2D echo,
Correct.
pumping, everything.
Right.
So we can modify those drugs. Even the mechanical valve patients can undergo pregnancy.
Okay.
So there are no issues. Definitely you can go, but it should be guided and done in a good place where you have a cardiac backup also.
Correct. Correct. Right. Other question is regarding the Ayurveda medicines. So, how Ayurvedic medicines are impactful for uh, heart conditions?
So what I will say, it's rather a good term is a integrated approach. So
Correct.
nothing and not
Yes.
it's a single pathy uh, is not always complete. What I
Correct. Right.
always feel that a lot of our ancestor medicines, they have proven to be good for blood pressure,
Right.
and even in cardiology, if you see,
Mm-hmm.
there is a role of Ayurveda,
Correct.
there is a role of yoga,
Right.
there is a role of integrated approach between cardiology, between Ayurveda, between
Right.
dietitian, between
Correct.
yoga teacher, we can exercise.
Yes.
So fortunately, in Bhaktivedanta Hospital,
Hmm.
under the guidance of Dr. Dalal sir,
Got
we
it.
have an integrated medicine
Medicine
department
department. Yes.
which handles all those.
Correct.
So there are Ayurveda principles which help, like Vata, Pitta. So I don't have much knowledge, but definitely you see one thing is an inflammation is an important cause of the damage to the
Damage to the
vessels
vessels. Correct.
which
Right.
supply the heart.
Right. Correct.
And what gets an inflammation is all those things. Inflammatory food.
Mm-hmm.
What is a inflammatory food? Is high carbohydrate,
Right.
high oil. These are all inflammatory foods.
Correct.
So if you see the fruits, they will reduce your inflammation. Highest value is amongst pomegranate.
Right.
It will reduce your inflammation.
Correct.
A good sleep will reduce your inflammation.
Right.
A control in the blood pressure, exercise will reduce your inflammation.
Right.
So don't think that only cholesterol is responsible for everything.
Right. Correct.
So there are other cells also, inflammatory cells. They will make your cholesterol plaque more vulnerable to get rupture and sudden heart attack.
Correct. Right.
So all those other factors also needs to be taken into consideration.
Correct.
So uh, yoga, Ayurveda, definitely in consideration with all those group practice.
Correct. Right. The time is tickling, of course. So, the last question, sir. Is there any a personal message or a thought you would like to share with our listeners about maintaining a healthy heart?
Yeah, what see happiness. So what we are doing, everything is for happiness.
Correct.
And then believe me, this happiness will help your heart.
Mm-hmm.
If you are happy, then enzymes will be released,
Correct.
endorphins will be released,
Right.
and they will keep your blood pressure down, they will keep your heart rate good.
Correct.
So happiness is one thing.
Mm-hmm.
What in young generation nowadays I see there's a lot of competition going on. They are not satisfied what they are doing. So satisfactory index should be good.
Mm-hmm.
Exercise, at least 30 minutes exercise, not a big job.
Right.
Do a regular exercise. Then good sleep,
Correct.
at least 6 to 7 hours, get a good sleep.
Right.
Dietary habits, as we discussed, have some fruits in your day to day life,
Correct.
salads, vegetables,
Mm-hmm.
those will boost up your health.
Right.
Then the cheaper outside foods, try to minimize.
Mm-hmm.
Then a doctor's advice, even if unfortunately if you get something which is detected,
Hmm.
don't ignore it.
Got it.
See what happens, there is a data in India
Mm-hmm.
that 50% of the heart attack patients, they don't reach hospitals,
Got it.
because there are many reasons for that. I will not say patients are responsible for that. There are
Hmm.
resources, lack of resources also, but at least don't ignore.
Right.
And don't do over the counter medications.
Correct.
What people do is I have some heartburn and then I go to the medical and ask for some
Hmm.
acidity medicine.
Right.
So we should not do it. If you feel something is unusual, get it corrected.
Got it. Right.
And definitely finances is an issue.
Mm-hmm.
So we should have a good insurance nowadays, protected. And another thing is efforts from the government. See what
Correct.
happens, these are non-communicable diseases.
Mm-hmm.
So nowadays they are the main public problems. So the awareness should come from all the levels, like
Right.
government, like from hospitals, like from NGOs. So there are studies. I will tell you interesting facts that cigarettes, if you see cigarette smoking, in 2014, government has increased the tax on cigarette 72%.
Correct.
So that has tremendously reduced the incidence of many problems because of the cigarettes.
Mm-hmm.
But unfortunately, what the social, if you have a poor socioeconomic strata, they smoke BDs, but the taxes on BDs is very less
Less. True.
because they are considered as a small scale industry product. The other is there are studies that if you increase the taxes by 20% on sweet beverages like cold drinks, the incidence of diabetes will go down
Go
by
down.
3%. The incidence of obesity will go down by
Absolutely.
3%.
Absolutely, sir.
If you increase the taxes on palm oil by 20%, in next 10 years, there are studies that at least we will save 3,60,000 deaths.
Got
So this is how the all the aspects should be considered
it. Right.
from our aspect, government aspect. I
Hmm.
know we have an financial issues also.
Right.
So whatever best we can do, at least exercise. There's no discrimination in finances.
Correct.
Everybody can walk. It's a very
Yes.
easy thing.
Right.
Spiritual aspect is also an important aspect, because
Absolutely.
if you have something meditation, spiritual touch in your day to day life, it will
Yes.
keep you grounded, keep you cool, and everything that is grounded, cool, satisfaction will help your heart.
Absolutely, sir.
It will beat nicely, keep you healthy, and your life expectancy will increase,
Correct.
and that too a healthy life.
Correct. Right.
So that is my advice: is keep the life as simple as possible,
Absolutely.
be happy, enjoy what you are doing,
Right.
and take a doctor's just experts advice.
Correct. True.
Don't do over counter medications. That is the advice, whatever take home message from today's
Correct. Right.
discussions.
So we'll take one last question. Please insist the remedies which give relief of a sudden heart attack and causing further impact.
Yeah, that is most important question. See what happens once there is a pain and patient collapses. There's a lot of panic in the
Yes.
general community.
Got it.
So your primary job is, unfortunately in India we don't have those numbers where we can call and urgent ambulances. So at least you restrict their activities,
Mm-hmm.
because any exertion will increase the demand of the heart,
Right.
and heart will get more fatigue.
Correct.
There are chances that it may stop also. So once you detect that patient is having some problem, heart attack,
Mm-hmm.
give him rest. Either ask the patient to lie down or sit comfortably,
Correct.
and without exertion, first thing is check his pulse, check his respiration. So take that patient to nearby hospital. Don't do any experiment at home.
Mm-hmm.
Even if you don't get a pulse or a respiration, then you can give a CPR at home.
CPR.
Definitely
Correct.
cardiopulmonary resuscitation.
Right.
Nowadays lots of hospitals through NGOs encouraging all those
Training
training
sessions.
sessions to
Yes.
the
Yes.
general persons for
Correct.
CPR.
Yeah.
It's not a big job, everybody can do it. If you
Absolutely.
give CPR, lots of lives can be saved, because
Yes.
we
Yes.
hardly have few minutes in cardiac patients. Life will be here and there in
That's
those
a
few
golden hour
minutes,
period.
golden hour period.
Yeah.
So if you reach the hospital in heart attack within 90 minutes, your heart, most of the chances there you will get a normal heart.
Absolutely.
But if you delay every minute after that,
Correct.
the every minute is muscle, what is
Right.
the
Correct.
terminology.
Correct.
So wherever facilities are there, get it hospitalized, get the treatment
Right.
done. So that is how a message we can give to those who get those patients across.
Absolutely, sir. Sir, in the comment section, a lot of people are acknowledging for our services, and obviously your name has been also mentioned in the comment section. So thank you so much, sir, for rendering the services for us and serving with the dedication and with that compassion to take care of our heart. Uh, Participants, you can see on the screen, we have flashed the contact number of ISKCON Devotee Healthcare Services, wherein you can reach out to us 24 by 7. We are available. Also, there is a ticker wherein the contact number has been displayed. So probably you can just get in touch with us. You can see right now on the screen 24 by 7 helpline number, that is 7391 040162. Again, I'm repeating, it is 7391 040162. There are so many questions also regarding this for the today's topic. Definitely you can get in touch with us and we will answer those questions to you back, maybe through one-on-one consultation or through the video consultation as well. So just a last message, sir, just take care of yourself, take care of your heart, stay fit, stay active and be happy. Thank you so much, Dr. Sandeep Patil, for
Thank
giving
you.
us the insights on how to take care of our health.
Thank you. Hare
Thank you so
Krishna.
much, sir. Hare Krishna.